Hi guys, welcome to my channel. Today we will talk about fatty liver disease symptoms, cause, and treatment. Fatty liver is also known as hepatic steatosis. It happens when fat builds up in the liver. Having small amounts of fat in your liver is normal, but too much can become a health problem. Your liver is the second largest organ in your body. It helps process nutrients from food and drinks and filters harmful substances from your blood. Too much fat in your liver can cause liver inflammation, which can damage your liver and create scarring. In severe cases, this scarring can lead to liver failure. When fatty liver develops in someone who drinks a lot of alcohol, it's known as alcoholic fatty liver disease, AFLD. In someone who doesn't drink a lot of alcohol, it's known as non-alcoholic fatty liver disease, NAFLD. According to a 2017 research review, NAFLD affects up to 25 to 30% of people. Trusted source in the United States and Europe. What are the symptoms of fatty liver? Fatty liver can progress through 4 stages. Simple fatty liver. There's a buildup of excess fat in the liver. Simple fatty liver is largely harmless if it doesn't progress. Steatohepatitis. In addition to excess fat, there's also inflammation in the liver. Fibrosis. Persistent inflammation in the liver has now caused scarring. However, the liver can still generally function normally. Cirrhosis. Scarring of the liver has become widespread, impairing the liver's ability to function. This is the most severe stage and is irreversible. Both AFLD and NAFLD present similarly. However, in many cases, fatty liver causes no noticeable symptoms, but you may feel tired or experience discomfort or pain in the upper right side of your abdomen. Some people with fatty liver disease develop complications, including liver scarring. Liver scarring is known as liver fibrosis. If you develop severe liver fibrosis, it's known as cirrhosis, a potentially life-threatening condition that can cause liver failure. The liver damage due to cirrhosis is permanent. That's why it's so important to prevent it from developing in the first place. To help stop fatty liver from progressing and causing complications, it's important to follow your doctor's recommended treatment plan. About the types of fatty liver disease. There are 2 main types of fatty liver disease, non-alcoholic and alcoholic. Fatty liver can also happen during pregnancy, although this is uncommon. Non-alcoholic fatty liver disease, NAFLD. Non-alcoholic fatty liver disease, NAFLD, is when fat builds up in the liver of people who don't drink a lot of alcohol. If you have excess fat in your liver and no history of heavy alcohol use, you may receive a diagnosis of NAFLD. If there's no inflammation or other complications, the condition is known as simple NAFLD. Non-alcoholic steatohepatitis, NASH, is a type of NAFLD. It's when buildup of excess fat in the liver is accompanied by inflammation. Your doctor may diagnose NASH if you have excess fat in your liver is inflamed, you have no history of heavy alcohol use. When left untreated, NASH can cause liver fibrosis. In severe cases, this can progress to cirrhosis and liver failure. Alcoholic fatty liver disease, AFLD. Drinking a lot of alcohol damages the liver. Alcoholic fatty liver disease, AFLD, is the earliest stage of alcohol-related liver disease. If there's no inflammation or other complications, the condition is known as simple alcoholic fatty liver. Alcoholic steatohepatitis, AIH, is a type of AFLD. It's when a buildup of excess fat in the liver is accompanied by inflammation, which is also known as alcoholic hepatitis. Your doctor may diagnose AIH if you have excess fat in your liver is inflamed, you drink a lot of alcohol. If it's not treated properly, AIH can cause liver fibrosis. Severe liver scarring, cirrhosis, can lead to liver failure. Acute fatty liver of pregnancy, AFLP. Acute fatty liver of pregnancy, AFLP, is when excess fat builds up in the liver during pregnancy. It's a rare but serious pregnancy complication. The exact cause is unknown, although genetics may be a reason. When AFLP develops, it usually appears in the 3rd trimester of pregnancy. If left untreated, it poses serious health risks to the mother and baby. If your doctor diagnoses AFLP, they will want to deliver your baby as soon as possible. You might need to receive follow-up care for several days after you give birth. Your liver health will likely return to normal within a few weeks of giving birth. What are the causes of fatty liver disease? In fatty liver disease, excess fat is stored in liver cells where it accumulates. A variety of factors can cause this fat buildup. Drinking too much alcohol can cause AFLD. Heavy alcohol use can alter certain metabolic processes in the liver. Some of these metabolic products can combine with fatty acids, leading to the formation of types of fat that can accumulate in the liver. In people who don't drink a lot of alcohol, the cause of fatty liver disease is less clear. For these people, it's possible their body produces too much fat or doesn't metabolize fat efficiently enough. One or more of the following factors may play a role in people who don't consume much alcohol and develop fatty liver disease: obesity, type 2 diabetes, insulin resistance, high levels of fat, especially triglycerides in the blood, metabolic syndrome. Other potential causes of fatty liver include pregnancy, side effects from some types of medications, some types of infections such as hepatitis C, certain rare genetic conditions. What are the risk factors? The main risk factor for AFLD is drinking heavy amounts of alcohol. The Centers for Disease Control and Prevention, CDC trusted source, defines heavy drinking as 15 or more drinks per week for men, 8 or more drinks per week for women. Research trusted source has found that men who consume 40 to 80 grams of alcohol per day and women who consume 20 to 40 grams of alcohol per day over 10 to 12 years are at a higher risk of severe alcohol-related liver disease. For reference, a standard drink contains about 14 grams trusted source of alcohol. In addition to heavy alcohol consumption, other risk factors for AFLD include trusted source, older age, genetics, obesity, smoking, a history of certain infections such as hepatitis C. The major risk factors for NAFLD are overweight or obesity, insulin resistance, type 2 diabetes, high cholesterol, high triglycerides, metabolic syndrome. Other risk factors for NAFLD include older age, having a family history of liver disease, taking certain medications such as methotrexate, Trexel, tamoxifen, Nolvadex, and amiodarone, Pasarone, pregnancy, a history of certain infections such as hepatitis C, polycystic ovary syndrome, PCOS, obstructive sleep apnea, exposure to certain toxins, rapid weight loss, rare genetic conditions like Wilson disease or hypobetalipoproteinemia. Remember that having risk factors means you're at an increased risk of fatty liver disease compared with people who don't have risk factors. It does not mean you'll certainly develop it in the future. If you have one or more risk factors for fatty liver disease, talk with your doctor about prevention strategies. How is fatty liver diagnosed? To diagnose fatty liver, your doctor will take your medical history, conduct a physical exam, and order one or more tests. If your doctor suspects that you might have fatty liver, it will likely ask you questions about your family medical history, including any history of liver disease, your alcohol consumption, and other lifestyle habits, any medical conditions you might have, any medications you might take, recent changes in your health. Let your doctor know if you've been experiencing fatigue, loss of appetite, or other unexplained symptoms. Physical exam. To check for liver inflammation, your doctor may palpate or press on your abdomen. If your liver is enlarged, they might be able to feel it. However, it's possible for your liver to be inflamed without being enlarged. Your doctor might not be able to tell if your liver is inflamed by touch. Blood tests. In many cases, fatty liver disease is diagnosed after blood tests show elevated liver enzymes. For example, your doctor may order the alanine aminotransferase test, ALT, and aspartate aminotransferase test, AST, to check your liver enzymes. Our doctor might recommend these tests if you've developed signs or symptoms of liver disease, or they might be ordered as part of routine blood work. Elevated liver enzymes are a sign of liver inflammation. Fatty liver disease is one potential cause of liver inflammation, but it's not the only one. That's from this video. Let us know what you think about the list in the comments section below. If you like this video, please like the video and subscribe to the channel. Thanks for watching my video.